So most people think that a dental cleaning is just a very superficial cosmetic procedure. It can be, but there's a lot more to the whole aspect. I've been a dental hygienist almost 30 years, and I'll be honest, the introduction of the glycine air abrasion powder, and now in Europe that we have the erythritol air abrasion powder, I'm just finding it's probably the biggest development in my 30 years in the profession. The feedback I have from patients is they feel their mouth is cleaner. Even though I did a very competent job beforehand with traditional polishing and instrumentation, the patients feel cleaner and the patients notice a difference. And that keeps the patients coming back. Now we know there's a whole oral systemic issue with our whole body health, and there's been links to the bacteria in our mouth, to heart attacks and stroke. So we as a profession need to inform patients, the regular public, of the importance of regular dental hygiene care to make sure that their general health can be good. When I was doing the traditional polishing with a rubber cup and paste, I don't think I was getting as much bacteria and biofilm removed. And when I think back, I think, wow, I probably could have treated a lot of patients more optimally if I would have had this technology 30 years ago. I don't think I could go back to the old technique. Seriously. I am so dependent upon this for the way I work and how I work that I don't think I could go back to traditional just hand scaling and polishing. I don't think there is a way back.